We're joined now by the Republican governor of Maryland, Larry Hogan. Governor, good morning.
Good morning.
Governor, thanks so much for joining us. As we just heard in Paula Reed's piece, only a fraction of those 20 million vaccinations at Operation Warp Speed projected for the end of the year have actually been administered. President Trump says the federal government did its part in getting those vaccinations to states. Now, as a leader of your state, where is the backup exactly, and do you have enough federal support?
Well, look, I think in the middle of this is the most important battle of this entire war against the virus, and it's a bad time to be pointing fingers when we really just have to bring everybody at the federal, state, and local and the private sector together to get this done. But, you know, the good news is that they actually are years ahead of schedule with Operation Warp Speed and getting these vaccines approved. And we have gotten our first batches out from the federal government, a little less than we anticipated. But we've now, in our state, gotten them to every single hospital, every single nursing home, and every single local health department, who now has to actually get the people organized and get the vaccinations into people's arms. But there's no question that we all need to be ramping up if we're going to get this enormous job done across the country.
It's absolutely all hands on deck, but where exactly are you seeing the slowdown? What parts of the supply chain are not working, or where is it that the vaccine is not getting to people's arms?
I think it's a little bit about all across the board. So the federal government did not deliver the number that they were originally telling the states that they would get. The private sector companies, currently two companies, but several more are getting close. But the two companies in production, I think their production has not been as fast as they had hoped, or what their projections were. And then there really wasn't a lot of support, no financial support, and no real plan. The states came up with their own plan, and it included sending these from the federal government directly to the hospitals and the nursing homes, and they're having a little bit of time getting ramped up as well, because it's a massive undertaking, and they've got to organize it in such a way that they can make sure to get the second dose within the couple-week period that are required. So it's not just sticking needles in arms. There's a lot of moving parts, and I think nobody is quite performing at the top capacity, and we've all got to work together to ramp it up.
Governor, moving on to this new strain that's been discovered here in the U.S., the one that has spread through the U.K., how concerned are you that that's already in Maryland, and what do states need to do to protect people?
Well, we're very concerned about the new strain. I guess the good news is that it doesn't appear to be more deadly, and that it appears as if the vaccines will be effective against the new strain. But the bad news is that it's so much more contagious and really ramps up the transmission rate, the positivity rates in a rapid way. So we're worried about it. We haven't seen any signs of it yet in our state. We know we saw the first case in Colorado. We haven't had direct flights from Britain. British Airways was flying into Baltimore Washington International Airport, but it was suspended back in March. We've got some pretty serious travel restrictions, but there's no way to stop the virus from sneaking across. We expect, and all of our entire team has been focused on what to do when we do have to face that.
Governor Hogan, thank you.
Thank you.